Okay, this time we'll bring Kathy and, looks like Cheryl here today, Kathy and Cheryl, to give us a update on the COVID-19. I think they've already given us some handouts.
Good morning, good evening.
Good
Mr.
afternoon.
Chair and Commissioners. Feels like morning every time I go to the board meeting, so it's morning for me. You received the handout I gave you on our data, again, that we provide weekly. You see that in Clay County, we have 5,510 cases as of December 7th. Those are the positive cases, so 57 additional reported cases. We have 64 deaths in Clay County. And our 14-day case rate per 10,000 people, and I describe that as that's one of the data pieces that we use for K-12 school planning, and that's 194.58. Now, we see that number has gradually increased over a number of weeks, and as we reviewed this with the superintendents, we also are noted that so many counties across the state have been over 200 now in that 14-day case rate per 10,000 people. The difference for that is, as the rate goes up, initially their plans were, we need to really watch that rate. And again, it's one data piece, but what we're finding is the level of positive cases are happening outside of the school system. They are not internally. So the processes that they have in the school of the protecting the kids and the staff is that they're following the guidance that they've been provided. So they're being very conscientious, again, using when they need to distance learning for some particular grades, and so it's hybrid. But every week they're watching the numbers and they're watching their practices internally, and the spread of this virus has not been prevalent in the school systems, and the it's all acquired through the community gatherings that they have. So that's the number we still are watching closely. Minnesota positive cases are 356, 152. Their cumulative deaths are over 4,000 now, 21 newly reported deaths, and the positivity rate is at 7.7%. You see the number of cases then in the U.S. Reaching 15, and then the total deaths across the U.S., 285,564. And then we have the global numbers as well. So the virus, as described by the experts, is not going away. We're expecting to see increases again this month. The virus is still present, and there's still a lot of community spread. So the message as we look at these numbers is we just continue the vigilance of wearing our masks, social distancing, staying home when you're ill, get tested. That's the message that we need to continue until we have vaccine for the public, and we'll talk about that in a little bit. Commissioner Campbell had asked for as you go to, I believe it's the third page, the number of the graphs for our Clay County cases by age, and also then our active cases by age. So you can see that we're still in that 15 to 19-year-olds and up to the 34 age group in our active cases. And similar, our largest percentage of cases cumulatively has been the 20 to 24, but we're still seeing those numbers in the 15 to 19-year-olds all the way up through the 30 to 34. So those tend to be the cumulative cases by age and the active cases, and we're still seeing the spread in those age categories. And then the last page, just a repeat of the Clay County positive cases, the 14 case rate in the Minnesota positive cases, those no longer needing isolation. And then the graphs depict that as well. So when the specimen was collected and the patient no longer needing isolation. So those are the numbers. When we started in March, you see the graph going up to November, and it's still going on an upswing with cases. Any questions that I can answer in regards to the data? can go into then the vaccine priority for public health is now we're into the vaccine planning. We're going to be receiving initial doses of vaccine in all the states, and in Minnesota, we should be receiving that vaccine, and it won't be directly, the first initial doses do not come to public health directly. They'll be going to the healthcare systems who have the capacity and capability to handle that ultra cold, which is a very highly sensitive vaccine that requires an unusual temperature management. Because it's unusual, we usually have frozen vaccine and refrigerated vaccine. So this is new for this COVID vaccine with the first company that is delivering that. So we'll have that availability. The emergency use authorization will be coming about December, sometime this week, December 10th through the 14th, and then they'll be able to start vaccinating. Now in Minnesota, there's a requirement, there's lots of requirements across the state, federal requirements that there is some training for those that are vaccinating. We have to have a vaccination plan, which we've developed that and have submitted that to the state. So there's a lot of pieces to put in play. Initially, the vaccine that is coming, the ultra cold, will be to healthcare workers. And then that will be phase 1. So those healthcare workers, and it's coming in various stages of, there won't be a large portion of vaccine initially. So we'll start with the healthcare providers, healthcare workers, and then it will also be long-term care, residents, and staff. So we'll be receiving, the healthcare facilities will be receiving that vaccine, and then they will be able to distribute it once it has gone through the process of authorization through the FDA. So that should happen, again, before the end of December. So we're expecting, after that, like week 1, I can give you a kind of a targeted plan. So week 1, we're expecting 46,800 doses from Pfizer, and that's the first ultra-cold distribution. And then in week 2, we're expecting 94,800. Now, this is across the state of Minnesota, just to clarify, it's not in Clay County. So 94,800 is the week 2, and that's Moderna, that's the other company that's providing the vaccine. And then in week 3, 41,800. So the tentative plan is in Minnesota, we should be getting around 183,000 doses for the first phase. So, and it is a 2-dose vaccine, so the first initial dose will be given, and these two companies have a variance of about a week. So one of the companies, it's 3 weeks later, you can receive the second dose. You have to have the same vaccine. You cannot, we cannot provide vaccine from 2 different companies to the same individual. So one company is 3 weeks and one is 4 weeks. So we'll see that second dose, and that'll be tracked pretty closely.
So Kathy, so the number of doses, are they going to give those, you said 180,000?
About 183 is the projected plan.
So are they going to give all of those out as a first round, or are they going to divide that by 2 and save for 3 weeks later?
One thing to clarify, and thank you, Commissioner Campbell, for that question. The vaccine is going directly to the healthcare system, so MDH will not be a warehouse to store that. And so that will be written in their plan, that they need to, so an individual gets the first dose of Pfizer, they need to save that second dose. They need to have that second dose available for that individual. So, they'll have to, you're correct.
They won't be waiting for a second shipment.
Correct.
And they have to reserve that.
They do have to reserve.
Keep it cold for 3 weeks then.
Yes, because you get the first dose, and it will give you that jump your immunity system a bit. It will be the second dose that really gives you, provides the full immunity. And after those 2 doses, you still have about 1 to 3 weeks before you're actually have the full immunity from that vaccine. But you are correct. They are saving that second dose, not waiting for the additional shipments. The federal government is the one that tells us how much we receive. when we receive it. They also have that prioritization plan. The state, we have a team at Minnesota Department of Health that is also working on recommendations for priorities, also developing kind of in line with the federal government, but kind of the plan for specific communities.
And then one more question, if I could. So it's going to those medical facilities. What about our first responders? When are they going to get it?
We have some phases that have been developed, and we're working through that. So the priorities initially are long-term care and healthcare workers, and then in the next phase, it will be first responders, other, I suspect, law enforcement, sheriff's department, the police department, some public health folks that are going to be providing vaccine. So there's another phase that we're working through on our plans with the Minnesota Department of Health. So those will be in an initial phase. There will be some, we had to document how many essential and critical workers we have in our county. So we included all of those individuals so that we would have that in our plan, that those could all be covered. This vaccine is for adults only, 18 and older right now. They don't have enough data and studies to have a recommendation for under 18. That may come in the future, but for this time frame, it's still 18 and older. There will be no sign up for the initial vaccines. There's not, like, you can't sign up for it. The people that have entered into a contract with Minnesota Department of Health they'll be determining that. Public Health, again, as I mentioned last week, we entered into a contract as well to be a provider for the vaccine. So initially with the priority areas, there isn't a requirement for them to notify the providers or for us. That will just happen. Down the road, when we're doing mass dispensing for the general population, that will be in 2021. That will be a different story, but for now, that's how it's going to be distributed. Is there any questions about the vaccine or anything that I can answer? That's the plans right now. We'll know more. We have multiple meetings every week, so we'll continue to provide more information as we work with the Minnesota Department of Health on the vaccine planning. And I'll let Cheryl talk a little bit about some of the other information we wanted to provide.
Good evening, everyone, and thank you. So first of all, just present you with some data from our vault testing site, our saliva testing site. For the week of November 29th, the number of tests were 4,518. Number of Minnesota residents was 2,160. Non-Minnesota residents were 2,358. Total number with results available of this report were 2,099. There were 346 positive results with a rate for the week, positivity rate of 16.48%. Any questions on those numbers?
That 346, that's the result of all 4,518 tests?
Yes, that is correct. Commissioner Campbell, last week you had asked a little bit more information about antibody testing. We do have that availability in the Fargo-Moorhead community. Generally from the CDC, the antibodies usually start developing within 1 to 3 weeks after infection. They still don't have enough information to say how protected someone might be from being affected again if they have antibodies to the virus. There have been some confirmed and suspected cases of reinfection from the virus that have been reported, but those are very rare. So basically, until the scientists can get more data on how much protection antibodies provide against being affected again, they just are urging individuals to take steps to protect themselves and others by wearing a mask, doing the social distancing of at least 6 feet, and washing their hands.
Thank you for that, Cheryl. I watched a little bit of a national conference today, And there was some dialogue about there, and it goes to what Kathy, what you're talking about in terms of the sequence of who's going to get the vaccine and when, and there was some commentary today that I heard that they said that those who have had COVID might fall to the very end. And I suppose that's because they probably are at a lesser risk, because I think the data is out there that being reinfected, it doesn't have real high numbers so far.
Sure. And I think part of that too is just taking the actions to protect yourself as well. The other thing that I wanted to talk about, a little bit about, of course, it's out on the news and everything, is the change that the CDC made a week ago, actually, with the quarantine time. So this afternoon, Governor Walz gave a briefing with Commissioner of Health Jan Malcolm and Director of Infectious Disease at MDH, Chris Arisman, and talked about the fact that they are now going to implement, as of today, the changes that have come about from the CDC for shortening quarantine time. So CDC, when they reviewed the data and considered the risks and benefits of sticking with the 14-day quarantine recommendation or shortening under certain conditions, and they're still saying that the 14-day quarantine is still the safest recommendation, but we know that there have been cases where it's very impacted heavily to people that may not have sick leave if they're just working at an hourly salary, and those types of things. So it's made it difficult for people to stay home for 14 days. Evidence is showing that the risk of a person in quarantine becoming affected is highest in the earliest days of that quarantine versus in the, say, the 10th through the 14th day. And shortening that quarantine time when the risk is much lower makes people more likely to actually follow that guide. The hope is that there'll be better compliance with slightly shortened quarantine times. Recommendation can be a net gain from a public health standpoint. And I hear that frequently on the various calls that I take during the course of a work day. And of course, the risk goes down as you get into those final days of the 14-day period, but there still is a small risk of transmission until they're past day 14. So basically, for shortened quarantine options, a 10-day quarantine would be applicable if you have not been tested, and then also a 7-day quarantine if received a negative PCR test. And a saliva test would be considered a PCR test. That must occur on day 5 or later after exposure. So you still want to continue to monitor your symptoms for those 14 days, isolate and get tested if your symptoms develop, and of course, wear your mask, maintain your 6 feet of social distance, and washing your hands too. Just follow the prevention guidance.
On that quarantine period, I mean, if I start feeling sick and I don't go get tested for 3-4 days, and it takes another 2 days to get your test back.
Generally,
When does my quarantine period start? When I start getting sick or when I test it?
well, generally, the shortened quarantine time is for people who do not have symptoms.
Yes, for the shortened, okay. Mm-hmm. But I was just thinking, as far as if I am sick for 2-3 days already, go get tested. You get your positive test, are you still 14 days, or do you go from the day you got sick, or?
Yeah, Commissioner Gross, it would be from the time your symptoms started, and you'd be isolated for 10 days.
10 days.
So 10 days are those that are symptomatic, but if you're sick, if you have the various symptoms we've talked about with COVID, you definitely need to be isolating yourself, but then go get tested. And then it's 10 days from when your symptoms started.
Okay, thank you.
So this is basically applying to contacts of positive cases, not to an actual positive case. You still have to stay home for your 10 days.
Okay. Very good. Anything?
And Mr. Chair, one more comment for, we are getting a lot of comments and questions about how safe the vaccine is because it's getting out so quickly compared to other vaccines. So I wanted to speak to, although it was developed more quickly than it ever has been, the speed did not decrease the safety. And part of that is they did phase 1 and 2 trials simultaneously. So they had people that they were testing immune response and safety. And because of the manufacturing phase, they typically would not develop all the vaccine without knowing the safety measures, because that would be a great amount of money that they would spend, and then to produce something that has to be thrown out. So because they were funded for all of this, the phases, they were able to do them simultaneously, and the manufacturing started right away without waiting for a period of time when the phases were to see, is this vaccine safe and viable? So to, just an explanation for the public to understand that because it is coming out quicker, there was a lot of resources provided to make that happen. So the vaccine, the safety standards have all been met, just as they have for any other vaccine. Okay.
you.
Any other questions, comments?
Any questions from the,
There's a Facebook page, Clay County Corona Counter, that kind of gives up-to-date daily updates on what our numbers are. And I think for the public to know that even though our 14-day case rate right now is 194, that end date on that collection was November 21st. So that was before the testing of Thanksgiving. And I think I would just like to thank the public for answering the pleas from people to be cautious and to be mindful of your exposure, because I think it's important to note that the numbers have dipped a little bit, not completely zero, but they have gone down a little bit, and so the measures that people are taking are working.
Yes.
Yes, they are.
Thank you.
thank you for the update again.
Yes.
Thank you.
Thank you very much.